بسم الله الرحمن الرحيم. It's my pleasure to highlight on few lectures related to the rehabilitation medicine part of rheumatology and rehabilitation, which is part of internal medicine. تأهيل الطبي واحد من الفروع المهمة للطب، فروع الحديثة deal with the handicapped, deal with reaching the optimal functional level of certain patients. قسم من المرضى اللي هو يكون في فروع الكسور أو في فروع النيورو ميديسين أو في فروع القلبية أو في فروع الطب الأخرى، يوصل إلى ليفل معين بحيث تكون الدراجز أو الأذر facilities already stopped, no aim, no certain real benefit. Rehabilitation medicine deal with these certain patients. I will give you 4 lectures, condensed lectures, included the skeleton part of rehabilitation medicine. بالمناسبة rehabilitation medicine بالعراق a new growing science، ضمن الدراسات العليا لكم واللي خلاني أركز على موضوع ريهابيليتيشن، أصبح أكو بورد ريهابيليتيشن ميديسين مثل بورد الكارديولوجي ومثل بورد الجاسترو انترولوجي ومثل بورد النفرولوجي. فهذه فرصة أن أعطيكم condensed lecture بالريهابيليتيشن ميديسين، يعني certain knowledge to be ready to prepare you to take part in this branch. Lecture number 1 deals with certain introduction and main topics of rehabilitation medicine. Introduction. Rehabilitation in general and physical medicine are essential components of comprehensive medicine, and the handicapped patients not fully treated until they have been rehabilitated to their optimal level of performance. واضح من التعريف أو الجانب اللي how to prepare أو to deal with these handicapped المعوقين handicapped patients. Rehabilitation medicine refer to, this is very important phrase I like to put in your mind، وأكيد راح يكون السؤال له علاقة بهالفريز الحلوة. The third phase of medical care. أكيد راح تسألون تقولوا لي عمو العد when the first or when the second phase of medical care to be instituted following the first phase اللي هي preventive medicine. First phase of medical care preventive medicine, and second phase curative medicine and surgery. لسوء الحظ في عملنا الطبي والمهني التركيز يكون على الكيوراتيف ميديسين والسيرجري. البريفنتيف ميديسين ماخذ حظ اقل، والريهابيليتيشن ميديسين ماخذ حظ اقل. واكيد يتبادر الى ذهنكم لان الكيوراتيف ميديسين والسيرجري هم ريليتد لشغلات برايفت وجود انكم، بينما البريفنتيف ميديسين ريهابيليتيشن ميديسين هو يكون الانكم اقل من عندهم. ومع الاسف this is not a correct rule. It was emphasized that in the period between the bed and the job, the bed means start illness, the job means complete cure. The patient, the period between the bed and the job emphasized, rehabilitation medicine emphasized on the period فترة between the bed and the job. The patient should be engaged in an active rehabilitation program rather than in passive convalescence. Engaged in active rehabilitation program rather in passive convalescence. Rehabilitation of chronic ill and chronic disabled is not just a restorative techniques, it's philosophy of medical responsibility. Failure to assume this responsibility means to guarantee the continued deterioration of many less severely disabled persons until they, too, reach the severely disabled person and totally dependent category. Neglection of disability in its early stages is far more costly than an early aggressive program of rehabilitation which will restore the individual to optimal self-sufficiency and functional performance. It's clear for you that early dealing with disabled, for example, if we take a stroke means hemiplegia, right-sided stroke, a brain injury. Stroke, clinically and medically, a neuromedical physician can deal with it within the first 5, 6, 7 days. And then what? Next step is rehabilitation, because all the facilities, all the drugs already prescribed. That's what we mean by early aggressive program, of which will restore the individual, dealing with individual. This draw attention to functional level must be created or must be reached when rehabilitation team is already used. There are some definitions which are important. Functional impairment occur at the organ level. Functional impairment occur at the organ level and refers to pathophysiology consequences of the disease. Then a functional impairment, a disability, and handicapped. Disability refers to an individual's limited physical ability that does not meet his or her needs. A handicap is disadvantage due to impairment or disability that prevents fulfillment of the individual's normal role in society. Functional level, organ level. Disability, individual's limited physical ability. Handicap, هو the patient disabled that prevent fulfillment of the individual's normal role in society. Rehabilitation team is very important word and very important topic. In all types of medical care, we must look for rehabilitation team. Team approach encourage communication, cooperation, and includes the following. In rehabilitation medicine, I mean physician, physical therapist, rehabilitation nurses, occupational therapist, recreation therapist, rehabilitation psychologist, medical social workers. بالمناسبة بالديوانية احنا مستشفى الديوانية اكو rehabilitation center dealing with the handicaps, and it also using the team approach and under the responsibility of rehabilitation physician. بالإضافة إلى الريهابيليتيشن ديبارتمنت موجود البروستاتكس ورك شوب اللي هي الأطراف الصناعية. احنا الاكزامبلز اللي نشتغل وياهم بالريهابيليتيشن ميديسين هم brain injuries and its sequelae, nerve injuries and its sequelae, orthopedic surgery, amputation of limbs and its sequelae. All they will end in the rehabilitation medical center and must be handled by rehabilitation team. Each patient reach the rehabilitation department must be evaluated. Patient admitted to the rehabilitation unit must be evaluated thoroughly according to the usual internal medicine are very important internal medicine steps with special tests necessary in physical medicine. The evaluation will consist of, this is very important for you, 1, 2, 3, 4, 5, 6. Identifying data, this is general, identifying data, and this is general in medical branches, name, age, sex, vocation, and others. This is as usual in your internal medicine case sheet. Full history taking, and as usual for you, general systems review. General systems review. Physical examination insisting on neurological and orthopedic survey, special test, vocational and psychological aspects. Identifying data, full history taking, system review, physical examination, special test, vocational and psychological aspects. What we mean by special test, because all the above are already normal for you and you hear about. Special tests in rehabilitation mainly concentrate on gait analysis. This is a physiological part of the lecture. Normal gait consists of two phases, stance and swing. Gait, stance, swing. Stance phase means the foot forward and the heel on the ground. It lasts until the second phase. The swing phase, it starts when the toes pushed off and the heel or the foot leaves the ground, and ends when the heel again touch the ground. So look for any omission, addition or variation from the normal. Was normal means stance phase, swing phase. Stance phase, foot forward, heel on the ground. Foot forward, heel on the ground. Last until swing phase, when the toes pushed off, heel or foot leaves the ground, and ends when the heel again touches the ground. For any omission, deficit, one of these signs, addition or variation from normal, the part participate in the body gait are the legs, fundamental part, pelvis, trunk, and even the upper arms. In rehabilitation department, any person already referred from any department, we must do testing for the muscle strength. This is very nice for you, and I want it in your mind because it's fundamental in rehabilitation process. 0% for the muscle, 10%, 25%, 50%, 75%, 100%. 0 means 0, 10% means number 1, grade 1, 25 grade 2, 55 grade 3, 75 grade 4, 100% grade 4. I mean a group of muscles, all you know in anatomy: biceps, quadriceps, triceps. For rehabilitation man, the muscle is a number, either 0 or 5. 0 means 0, that's no evidence of muscle contractility, no evidence. 10% اللي هي grade 1, in another word T أو trace, means slight contractility. 25% اللي هي grade 2, P or poor, complete range of motion with gravity eliminated. With gravity eliminated. Just to show you, triceps muscle, if the arm is in 180 angle, triceps muscle, which moves the forearm against and with gravity. Concentrate on the triceps muscle as an example. If there is no evidence of muscle contraction, means 0. Slight contraction just seen by the eyes means 10%. Complete range of motion with gravity eliminated, 2. Complete range of motion against the gravity, 3. complete range of motion with some resistance from you on the triceps. Just imagine what I said means 4. Complete range of motion with 4 resistance, grade 5. Very, very, very important. Concentrate on each group of muscles or only single muscle. Look at as within these 5 grades. And the aim of rehabilitation, if we receive a muscle or a group of muscle at the examination, grade 3, we must or we hope we can reach it for the 50th grade or 40th grade. This is the advancement of our job. Another special test, very important, spasm. Each group of muscle, either spasm, severe spasm, contracture, continuous severe contracture. Above the degrees of spasticity word related to the upper motor neuron lesions. Upper motor neurons. In neurology, I want to remind you that there's a lower motor neuron, upper motor neuron. Lower motor neuron means peripheral, upper motor neuron means central, which is in the brain and the cord. In our department, the patient come with a brain injury, cord injury, come with spasticity. The other word you must remind is rigidity, and I hope you will look for what's the difference between spasticity and rigidity is very important for you. Range of joint movements are very important. Our aim is to increase range of motion of each muscle group or joint. Range of motion related to the joint. And I want to remind you that the joints in the body are 3 types. Fibrous, which is no movement. Fibrocartilaginous, which is little movement. And the sign of joints, which are the most important part of body joints. And it includes about 157 joints in the body. All have certain numbers. Flexion, extension, pronation, supination. There is a range of motion. Our aim is when we receive certain joint already affected by external insult and there's a deficit in its range of motion, we're looking to increase its range of motion. Most musculoskeletal lesions impair the joint movement since the impaired degree has an capabilities. It is essential to have reliable methods of measurement. Most musculoskeletal lesions impair the joint movements since the impaired degree has an capabilities. It's essential to have reliable methods for measurements. Goniometer or goniometers is an instrument for measuring range of motion. كأنما المنقلة نسميها اللي تقيس زوايا المفاصل معروفة كإنسترومنت موجودة بالقسم rehabilitation medicine. ملاحظة مهمة. All the body joints have certain direction and degree. This is very important and must be know from your anatomical study. Special test. Testing the activities of daily living. This is a pure rehabilitation. And you must think of ADL. Activities of daily living. Each one of you has certain activities of daily living which are sometimes common between all or sometimes special for each one of you. The following are the major groups of activities which must be tested. Bed activities, wheelchair activities, self-care activities, either toilet, dressing, eating, etc. Ambulation and elevation, standing, sitting, climbing, and travel. Miscellaneous hand activities. Bed activities means bed transfer from the chair to the bed, from bed to the chair, from on the bed, turning on the bed. Wheelchair activities means movement, getting on, getting off. Self-care activities is clear for you. Ambulation and elevation, standing, sitting. All these are parts of the main parts of our rehabilitation work. Grading for each activity. very important for you. When we receive patient, we test all the activities, and after the rehabilitation program, we already again test the activities of daily living. Nice to keep in mind, right? Can perform activities independently. This is the full, like you. Needs supervision S, needs assistance A. Patient has to be lifted L. Activity cannot be achieved if you are already paralyzed. I hope I gave you a certain concentrated introduction in rehabilitation medicine lectures, and thank you for listening.